we go back and say a little more about your grandfather? He was medical officer of health in Leith. What year would that be, roughly? What sort of time?
I think it was the 1860s. He, I'm sorry, that's not right. Not the 1860s. It must have been much later on. It was the 1880s. I think it was 1886 to about 1894. He was the first of all part-time and then full-time medical officer of health in Leith. And he seemed to combine that with being on the staff of Leith Hospital and also with his general practice. How he managed to do the lot, I'm not quite sure, but that was...
That must have been a very, shall we say, interesting period to be a medical officer of health in Leith, because there would be a fair degree of poverty, I would imagine, in Leith at that time.
I think there was. I mean, they lived at 107 Ferry Road. In fact, my father was born, as we say, above the shop, above the surgery. But certainly stories that my father told in the short while that he was in general practice with my grandfather before he went into bacteriology, there was a lot of poverty. And of course they had incoming problems with sailors coming off ships at the port of Leith, bringing in sometimes infections that had almost gone out like typhus. And one of the things that my grandfather was particularly adamant about and upset the directors of Leith Hospital enormously because he really pilloried them and maligned them, was that there was an insufficient adequate accommodation for patients with infectious diseases who were roomed in with people without infection. Inevitable result, cross-infection, infection of staff. Quite a few nurses went down with typhus. And I believe a young doctor died of typhus there. I think the amount of infection in the community, communicable disease in the community, had waned. It was, simple things, reduction of overcrowding, rehousing the populace. It was better sanitation, better water supplies, simple things like this, better nutrition, the sort of things that you were particularly interested in your studies of the origins of the National Health Service. And how these pili-wali creatures with tuberculosis who were following Kitchener's finger in the First World War and so on. But I think public health measures have a huge amount of gave a huge amount of benefit to the general population and brought about the beginning of the waning of these great scourges of infection.
There were some very, very poor parts of Leith. They were condemned and occupied by squatters, and there was a lot of very poor child health, but these were sort of bulldozed and the people who had moved out to Western Hills mostly.
Poverty was extreme, there's no doubt about that. Certainly Rickets was common enough. It seemed to me the only milk a woman would get to drink in the week would be a little, with her tea.
Yes.
No more. The kids might have what could be spared, but poverty was of that extremity, certainly. Yes.
A lot of the old Leith slums had been knocked down and people sent off to places like Western Hills.
Yes.
Now they hated that.
Yes.
Absolutely hated it. A lot of them came back. They did not like living out of Leith at all. A lot of them came back. I did know Leith way back in the 40s because I did my district in midwifery in Leith. I really hadn't encountered anything like it in my life. The degree of deprivation and poverty at that time, about 1946, just after the war, was just appalling. We lived, the students, there were two of us who were doing midwifery, lived in digs in Wrestlerick, quite near the district nurses. And when we were called out, we went with a midwife to the house. Sometimes there were no clothes for the baby. Sometimes there was nothing. There wasn't even a crib. I've seen a child put in a drawer, taken out of a chest of drawers. That's all they had. Sometimes there was very little food in the house, and the midwife and I we'd club together and send out for fish suppers, and we'd all have fish suppers together. Sometimes we'd get a cup of tea, but sometimes there was very little food in the house. Sometimes the degree of hygiene and cleanliness was pretty low, and when we came back regularly, I used to stand in the middle of my room, put out newspapers and then strip and catch the wildlife as it came up. But that was a regular thing. But yes, that sort of deprivation and slum had by the 70s disappeared.